All right, Nico, can you say, welcome to another episode of Healthy Births, Happy Babies?
It's a happy episode. Happy babies.
Hello and welcome back to another episode of Healthy Births, Happy Babies. I'm Dr. Jay Warren, your host. I'm also a prenatal and pediatric chiropractor here in San Diego at the CAP Wellness Center. And on today's episode, my guest is Dr. Linda Slak. And what we're going to be doing on this episode is kind of an integration of some of the other topics that you might have heard in the previous couple of episodes. We did an episode on milestones in the first year of your baby's life and what they mean and when they should be hitting them. We did an episode on primitive reflexes and what they mean and what you can do about them to make sure that your baby's neurologically developing and integrating them as they should in the first couple years of life. And what Dr. Slak is going to do today is integrate that information and help simmer it down into a way that you as a parent can understand how to allow your baby to really grow and develop in this first year and definitely in the second year as well on their own, like taking cues from them, not trying to push them too far, too fast, so they don't skip milestones and they don't skip neurological integration steps that are going to be really, really important for the foundation of their growth and development later on. And she's going to explain that really, really well for you right now. So let me take a break for a quick second. I'll let you listen to this message. I'll come right back. I'm going to introduce Dr. Slak to you, and then I'll switch over to our conversation so you can learn all about it. My online course, Connecting with Baby During Pregnancy, has been out for a while now, and I've been getting phenomenal feedback from you women who have been learning these prenatal bonding techniques, putting them to use, and having amazing results. The same kind of results that the women in the Rafi study were getting, where by doing these techniques throughout pregnancy, they were having less anxiety and pain during labor. They're needing less obstetrical interventions, including less C-sections. And then afterwards, the babies are sleeping better, which means you're sleeping better. And postpartum depression was less than 1% in the moms who did these techniques. So go over to my website at drjwarren.com/CWB and learn all about it. I think this course is amazing. I put a lot of effort into it, and I think it'll really help you have a healthier, happier, and more relaxed pregnancy and a gentler yet powerful birth. All right, my guest today is Dr. Linda Slak. She practices with her husband in Burlington, Massachusetts, where she's provided chiropractic care to families for over 30 years. She's dedicated to advancing the authentic philosophy, science, and art of chiropractic with a neurologically-oriented approach to optimizing the expression of human potential. Dr. Slak earned her doctoral degree from Life University in Marietta, Georgia, and then trained in prenatal pediatric care and pediatric neurology with the International Chiropractic Pediatric Association, the ICPA, and the Carrick Institute of Neurology. She is board certified through the Academy of Family Practice, the Council on Chiropractic Pediatrics, the American College of Functional Neurology, and the American Board of Child Developmental Disorders. In addition, Dr. Slak sits on the boards of the ICPA, Partners in Perinatal Health, and the Massachusetts Alliance for Chiropractic Philosophy. Dr. Slak has been a speaker for the Nursing Mothers Council, the Massachusetts Breastfeeding Coalition, Partners in Perinatal Health, Life University Continuing Education, the ICPA Summit, and many, many more. Dr. Slak is also an instructor for the ICPA certification program and is the co-founder of the Slak Institute, which provides advanced postgraduate courses to doctors who specialize in chiropractic pediatric care. So with all of that, let me now switch over to my conversation with Dr. Slak. All right, Dr. Slak, welcome to the podcast. Thank you for joining me.
It's great to be here, Jay.
Yeah. Well, we were talking before we pressed record just now about the other podcast that we've recently done. Our fellow ICPA instructors have been talking about milestones. We've been talking about primitive reflexes, the first year, and the importance of all those things. And I'm excited to talk with you so that our parents, having listened to that, will be able to kind of integrate it in a different way and a more functional I want to say in the trenches, more like on the rug in the house with kiddo. But before we jump into that, Dr. Slak, we heard your bio and all of the great accomplishments that you've done, but tell us a little bit more about like how you got interested in working specifically with kids, and then we'll be able to talk more about that.
Sure, Jay. So I've always had a family practice, but about 20 years ago, I think my interest in children became heightened with the experiences I had with my own daughter. So I have a daughter with some neurodevelopmental challenges, and we really didn't want to put a label on it, but she has dyslexia. They did want to do ADHD at one point and didn't because we refused to medicate. And I was fascinated by her brain. I look at these children that, in school, they're considered dumb, they're put down because they're on special ed plans and they have to be taken out of the regular classroom and put into a special ed classroom during part of the day, and the other kids think of them as not so smart. Well, my daughter's brilliant and her mind works, it is amazing. So it intrigued me so much that I really wanted to go on and learn more about neurodevelopment. So I went on to train with the Carrick Institute in child developmental disorders, and also through the years got certified through the ICPA as well.
Very nice. And now you're teaching with the ICPA,
Yes.
you're teaching assessments for other chiropractors like myself that are working with kids in the exam and looking at all these functional assessments that we can do technically as doctors, but then also relating it to the parents, like what those things mean is so, so important. So like we had said, we talked about the importance of primitive reflexes and hitting milestones, but there's a lot that you teach the parents that you work with about how to allow their brain to naturally develop and function rather than using all these kind of apparatus that are thrown at us as parents. And I would love for you to talk more about like what we can do in those first months, or maybe what we shouldn't be doing.
And things that we do that are natural that we don't even consider. So the first one is breastfeeding. When an infant is breastfeeding and they're lying for one side and then the other, they're actually developing each hemisphere of the brain while they're breastfeeding without us even having to think about it. So a mom who's breastfeeding in the beginning, I think it's really, really important. And as chiropractors, we encourage and give the mom encouragement to continue, especially when she's having struggles. And one of the things that I see very early on is moms, or if the baby hasn't gained the proper amount of weight, or they haven't come back to their birth weight in the first 2 weeks of life, the pediatrician will oftentimes pressure the mom to supplement, either pump and express more milk and do an extra bottle, or you start to use formula. And if they start using formula, it can be the beginning of the end of the breastfeeding relationship. So in my practice, I really encourage the moms not to do that, or also in history, asking them, did they have IV fluids when they were giving birth in labor, because those IV fluids go through to the infant and cause a birth weight that's elevated, and it's not the actual birth weight. So if that's the case, then in 2 weeks, that child might be perfectly back at what should have been their normal birth weight. So I like doctors who aren't so concerned and don't put so much pressure on, because things always even out, right?
Right.
As things get going. And then what a lot of parents don't know is that in the first 3 months of life, when the infant is in a lying down posture, we need to really pay attention to what they can do at certain stages. And in the beginning, when they're in lying down posture, we don't want them in an upright posture more than a few hours a day. Because if we do that, then that will engage the upper parts of the brain or the cerebral cortex too soon, and it may lead to the skipping of one of those very important milestones, like crawling or sitting, standing to walk.
And how do you mean by that? That if they're upright, then those upper brain centers, because they're able to perceive and they're looking at things in a different way? Or is it the gravity environment, or both?
Yes, when they're in the upright posture, they start to look. They're engaging up in the upper centers of the brain. And in infancy, the infant is only really utilizing the brain stem. That's where all the primitive reflexes come off of, cranial nerves. And so, as the brain matures, we say that it matures really from the bottom up. And you can think of it as stepping stones. As that child goes through their milestones, they go through stepping stones from those primitive reflexes that develop into the postural, more advanced reflexes that stay with us for the rest of our life.
Okay, great.
Yeah.
And is that something that then, as far as like skipping milestones, like how do you prevent a kid from skipping one?
So, great question. I love following children at least through the first 2 years of life in my practice, because we want to monitor them through those milestones. And one of the most important things that we can do is remove the nerve interference in the structure of their spine, so that the brain can connect to the body properly and they can meet those milestones. If they're not meeting them, we can teach the parents things that they can do at home. And also, it's very important for them to have chiropractic care.
Right. Because that's something I know a lot of parents are either worried that they're going to skip one, instead of like thinking of them like not fully developing one of them, go like in a foundation leading up there. But there is that feeling, especially with walking, of like, oh yeah, my kid's like so great. They skipped crawling. They didn't even need to do that. They went right to walking. We understand, as far as brain development, how important that is. So
Right.
how do you usually talk with parents about that foundation and how it builds?
Yeah, so that usually comes up actually around the age of 3 months,
Mm.
when the infant starts bearing weight on those feet. And I remember one instance in my practice where a mom came in, and the dad was so excited that the baby could already bear weight on her feet. And he says, look, she's standing up. She's so advanced. And we think that it's advanced, but it's not. We don't want them to want them to be doing things ahead of time before, we want it to happen in the correct order. So I had to talk to the dad to tell him that, no, this is not good. It's not time for being weight bearing. But it is normal for the infant to start bearing weight on their feet at 3 months. And then at 7 months, they'll start to bounce. But that doesn't mean we're going to put them in a jumperoo at that time and have them being
Right.
upright, because their spinal structure isn't strong enough to support the weight in an upright posture. So we need to allow the infant to go through. We need to not rush things. We need to let them do things at their own time, even coming from lying to sitting. A lot of times we try to stimulate that too soon as well, or encourage it too soon. We ideally want to wait for the infant to be getting up and sitting on their own
Okay.
before we encourage the sitting posture.
Right. Because that's, as they're trying to sit up, those are the strengthening and like stimulating the nervous system to coordinate that on their own, rather than kind of
Correct.
us pulling them up and then all of a sudden they're trying to navigate it. And they might be strong enough once they get there, but they haven't learned themselves to get them there. Is that what you're saying?
Yeah.
Yeah.
And you notice when they start to sit up, they will prop themselves. They'll usually lean forward first, and before they learn how to properly prop themselves laterally and backwards and be really stable in that
Right.
position.
And that's the problem with the bumbo seats, because it's
Yes.
loading their pelvis and their spine. Can you speak to that?
Yeah, the bumbo seat just first of all, it supports them, right? So parents put them in there, like I said, before they're even ready to be sitting. So they're so neurologically, it's not good. And then for their hips and pelvis, it's not good, because you've got improper weight bearing, stresses, improper stresses within the structure. So definitely not a good thing.
Right. And because they don't have the coordination of sitting up on their own, that's the danger of them also falling out of it. There's been cases where, a kid's fallen backwards or to the side in the seat because it was just way too soon. So obviously there's that danger there with a
Hmm.
injury, but then also that chronic loading on the pelvis will interfere with that development. But it's, it makes sense. I understand how parents, and I was a parent of a young child too, were like, oh, it's so cute. Look, they're sitting up already and I get to interact with them. They've been laying on their back for so many months. Now I want them sitting up, but we really want to let them lead.
Exactly. And then when we get to crawling, what parents don't realize is when the infant gets up onto all fours and starts rocking back and forth, they're actually developing their near to far vision or accommodation with their eyes as well. So many things are going on neurodevelopmentally that happen naturally, that need to happen, um, that we don't really realize because it just occurs naturally.
Right. And crawling is such an important one. I mean, it's such a cute
Hmm.
phase when they're doing the rock and like they're like, it's almost like they're trying to do double dutch and get into the like ready one, I think I'm gonna go. Or they start moving backwards and they get mad because they're moving backwards and they're
Right.
going away from it. But all of those different aspects of things and letting them do it the way they do it. I mean, that's parenting in general, right? But as far as neurodevelopment, that's kind of our first testing ground to allow them.
Right. Exactly.
And the same thing with like pulling themselves up and doing the traverse. Like talk about like with walking and the like, what are the kind of first stages or the first building blocks as they're pulling themselves up and trying to traverse and then walk on their own that you want to allow them to do rather than inhibit or push too much.
Yeah, so when they pull themselves up, usually originally they're going to be walking along furniture or supporting themselves that way, and then they'll be tipsy turvy, right? Topsy, like they'll have their arms up and their legs will be wide stance, and to try to get their balance, you want to allow them to do that, and they're going to take a lot of spills usually during that phase, needing more chiropractic care and to be checked more
Exactly.
often through that process. Um, and we want to allow them or give them the opportunities to be able to do that on their own.
Right. And that's something that once I've talked with a lot of families that in my practice that they think like really the first year and getting to walking are the milestones, but there's a lot that occur afterwards that I'd love for you to share with our parents more to look for, like in that second year of life.
Yeah, so in the second year of life, what we want to see, we want to see the child being able to start to coordinate from large muscle control, then going into more fine muscle control, being able to cross the midline, um, being able to jump, hop, run, um, start to have better eye-hand coordination. They're going to be able to coordinate with um, using their hands to draw, coordinating the neurodevelopmental stages of setting them up in the future for getting to school
Right.
eventually.
And that fine motor coordination, and it's a technical term for like a kid being able to like pick something up with their fingers, put it into another place, put things in containers, those kind of things, really can be hindered by the parent just doing too much for them. And one of the things too, I'm sure you talk about it, is like that mirroring, that like if we're doing like we having the kid watch us do it ourselves and then give it to them to do it rather than us moving their hands. Is that how you teach it as well?
Absolutely.
Yeah.
Yeah, and the other thing that I just read, actually, a study that just came out too, was like at around the age of 2, 2 to 6 is when the 0 to 2 is right brain dominant, and from 2 to 6, the left brain kicks in and becomes dominant. That's language skills and the fine motor coordination. So what at this phase, we don't want to push, like to teach the child to read, for example, and do mathematical computations before they're ready. From 0 to 2, we want to let that right brain totally develop that creative side. And if we allow that to happen and don't push left brain activities before the age of 2, when it's ready to kick in, the left brain will nurture the right hemisphere
Right.
and will have very healthy brain development from that point forward.
Right.
The other thing that's important with walking is movement is what forms new neuronal connections all through life. So we have the left side of the brain and the right side of the brain, and then we need to form connections between the two sides for healthy development and for proper brain function. So if we don't, and that happens through movement. And today our children aren't moving enough. They're sitting on computers, they're sitting, on their telephones, they're sitting playing video games. And very rarely do we see, even in my neighborhood, it's like a ghost town outside. You hardly ever see kids outside playing, riding their bikes on the swings. And that is so, so important for neurodevelopment.
Right. Because even like going back to what we were talking about, like 0 to 3 months and on too, like all the carriers that are there and the devices that instead of a kid kind of being on like a play mat or on a blanket on the floor and rolling around and playing, they're in an apparatus that's kind of containing them to some degree and propping them up maybe sooner than but they're not really interacting in the world. They're hopefully just sitting, but then parents are saying, well, yeah, he doesn't really like that seat. He won't stay in it. It's like, well, because he wants to move. Well, let's let him move, and then he'll be much better off.
And for coordination, it's really important that we allow them from, like, especially at age 3 months on, and when they're in daycare, I tell parents to tell the daycare provider to put them down on a mat and let them have free play and free time. Tummy time, of course, is super important as well, but they need to have that free play to get the coordination to go from automatic to controlled use of their arms and legs, and knowing where they are in space for proprioception. So it's so important. One of the things that actually inhibits that is swaddling too long.
Okay.
So up to 3 months is okay. Anytime after that, what I see in my practice and how I know that the parents are still swaddling like a child from 4 to 6 months is that when you put them into tummy time, their arms will be down by their sides and out like Superman, right? To the lifting up, or in a 90 degree, because there's one of the sleep suits, I think the Merlin suit, puts their arms up into a 90 degree posture. And so the child, when you put them prone, their arms are in that position and up. So they never put their hands down to push up to get into the crawling phase, to push up into all fours. And so it can cause a delay in development.
And so swaddling up to 3 months, you said, was appropriate. And then afterwards, so let them
afterwards
roll.
You want them to have free movement.
Okay. Wow. I never heard that before. I'll look for that. The kids I'm working with. So in our final minutes here, where can people learn more about what you're doing? If they want to contact you with some of these questions there, do you have places for them to find you?
Yeah. The best way to contact me is really directly through my email. It's lslakdc@gmail.com.
Okay. I'll put that in the show notes, people that are listening, so you don't have to write that down now, but it'll be in there so you can contact her. Thank you. That's very generous of you to put that contact there. What's the major take-home message that you like the parents listening to get from what we talked about here today?
Yeah, I think that the most important thing for a parent is to follow their gut feelings and their natural instincts. There's so many people that try to tell you how to do it right. And I think in your hearts how to do it. And I think that you should listen to your own instincts.
Beautiful. I love it. Well, Dr. Slak, thank you so much for being here. Thank you for sharing your wisdom. I really appreciate it.
It's been a pleasure.
Hi, it's Dr. J again, and I want to thank you so much for listening to the podcast. It's something I really enjoy doing, and I, as a parent, learn a ton from these experts coming on and sharing their wisdom, so I hope you're getting a lot out of it too. And I want to share something else with you. I've created a guide called the 40 Ways to Connect with Your Baby During Pregnancy. It's full of simple things you can do on a day-to-day basis that will help strengthen that bond that you have with your baby. It's a free download. You can go to my website at drjwarren.com/40ways and just enter your email. I'll send it right to you. You can download it and start working on it right away. All of the research that I'm learning in the fields of epigenetics and attachment parenting is showing that the more bonded you are during your pregnancy with your baby, the better the birth is going to go and the better parenting is going to go, because you have that strong foundation, a strong connection to build upon. So go again to my website. It's drjwarren.com/40ways and get that free guide. And again, thanks for listening.